Clifford is presented at the initial examination at a little over 6 months of age. He shows signs of injury after jumping off a height. Clifford limps on his left hind leg and relieves it. He also regularly looks backwards, particularly to the left, and shows a desire to gnaw there. After administration of PTA painkillers by the in-house vet, his condition did not improve. X-rays and further examinations at the vet's office did not result in a diagnosis or therapy. Therefore, Clifford is referred to us for further examination. In the assessment of his gait, Clifford shows clear abnormalities. He has a pelvic twist, which causes the pelvis to sway to either side during movement. He also has a bow leg stance in both knees and an X-leg stance in both tarsi. His sitting position shows a wide-legged stance, and his forward movement is in a pull move by pulling with the forehand. The position of his forelegs is also tight. When looking at his gait from the side, further characteristics stand out. His hindquarters are overbuilt, they are higher than the forequarters. In addition, the hindquarters show an incurvator. The hind legs are placed below the center of gravity and thus forward. The hind limbs are set off turning, which means that they show a circling movement from the outside to the inside. The head is held more in line with the spine, thus generally lower. Clifford shows virtually no upright posture of head and neck. This serves to balance the body's center of gravity. The diagnosis revealed that Clifford suffers from bilateral hip dysplasia, with the right being more affected than the left. The distraction index, 0.5 in each case, and the DAR angle of 25 degrees on the right and 20 degrees on the left, indicate moderate to severe dysplasia. The Norberg angle of 98 degrees is indicative of mild dysplasia. In conjunction with the results of the DAR and distraction method, moderate to severe dysplasia can be inferred. The recommended treatment for Clifford was intra-articular infiltration of polyacrylamide hydrogel, PAAH, in combination with platelet-rich plasma, PRP. This option was chosen as Clifford is not yet fully grown and was showing significant lameness with pain and loss of performance. PRP is used to reduce inflammation and pain, while PAAH stabilizes the joint cartilage and cushions the joint. The infiltration therapy provided some positive changes, visible here in the comparison of the kinematic values. The stance and swing phase increased evenly in both the forehand and hindquarters. Flexion and extension now show a practically even distribution and remained largely unchanged. Angular acceleration normalized and the distribution in the forehand and hindquarters balanced out. After therapy, Clifford's gait showed a significant improvement. He moved smoothly and fluently, was no longer overbuilt, and showed neither a pull move nor lameness in the forehand. His push move from the hindquarters is good, and he no longer shows lameness, nor gnawing of the hindquarters. His hindquarter muscles have strengthened, and his muscle mass has increased significantly. The treatment had helped to improve his quality of life and restore his mobility.